Today I'm going to talk about erectile dysfunction. Erectile dysfunction is the inability of a man to maintain a good erection sufficient for satisfying sexual activity. The physiology of erections is quite complex. There are vascular, hormonal, neurological, and even psychological factors that all play into erections. In my practice over the years, I have been surprised at this increasing incidence of erectile dysfunction in men. I wasn't surprised to see a book called Countdown by Shana Swan a couple of years ago that actually showed that men's testosterone and sperm had dropped 54% in the last 4 decades. Probably as a result of the increasing toxic environment. For instance, plastic water bottles that we drink out of has a lot of phthalates. These things are very toxic. So in addition to these falling hormonal levels and the increasing pollution of our planet, there are many young men, even in their 20s and 30s, that I see that are having some issues. In fact, in Shana Swan's book, she attributes the tremendous fluid gender issues also partly to this environmental toxicity. The other very important issue for men to understand is that there is a very strong link between cardiovascular disease and erectile dysfunction. I would say that nearly 50% of men over the age of 50 experience some erectile dysfunction, and many of them on a regular basis. The large majority of these men have diabetes. They are often overweight, very insulin resistant, pre-diabetic or diabetic. This link between ED and vascular disease was actually first written about in 2003. There were 300 men that came into the emergency room of a heart attack, this cohort which they collected. The prevalence of ED in this study was 50%. And 70% of these men had developed ED in the 40 months before they presented to the emergency room. The reason for this is that the diameter of the artery to the penis is 1 to 2 millimeters, whereas the diameter of your coronary arteries to your heart are 3 to 4 millimeters. In other words, you have a smaller artery going to your penis than you have coronary vessels. And that is why it is like a canary in the coal mine. It's giving you a warning when you have ED that something might be going on in your vascular system to the heart. Here at Eternity, we always get a coronary calcium score, which is a simple $75 test, where we see if you have a lot of calcification in your coronary arteries, which is a tip-off to us that you have vascular disease. So in other words, erectile dysfunction is really atherosclerosis of your penile vessel until proved otherwise. Now, treatment options. Here at Eternity, our program is divided into 2 parts. Part 1 is there's a lot we can do that is relatively inexpensive and easy to do. For instance, the first thing is to reverse your diabetes, to reverse your insulin resistance. And this can often be done in a very short space of time, often in just a few months. Number 2, we do use hormonal therapy. Things like testosterone, HCG, Clomid, depending on your age, etc. There are other select pharmaceuticals we use, Trimix, Quadmix, other kinds of pharmaceuticals that are very effective. We also use select peptides, PT141 for instance, very effective. We use biological therapies. We also use occasionally our neogen, which is electrical cell stimulation, that can be quite effective. We also can use PRP and umbilical cord tissue, which we inject. There's several nutraceuticals that we use that are helpful. And sometimes a little psychological counseling helps. That's really part one or phase one of our ED program. And in most cases, this produces a really good result in the large majority of men. The second phase is where we use the acoustic wave therapy, which is an ultrasound device, which has been shown to be quite helpful. Finally, we do use stem cells, which we inject directly into the penis in the more severe cases.